My name is Jason Chang. I'm an assistant professor at the Department of Rehabilitation and Regenerative Medicine at the Columbia University Irving Medical Center. Growing up, I actually wanted to be a magician, and I had opportunities to perform magic at different hospitals, nursing homes, as well as different schools. I found that so rewarding because I could bring so much joy to all these patients. But the joy was so temporary. And from seeing all these doctors and nurses do their work, I saw how much of a lasting impact they provided to their patients. And so that's what really drew me to pursue a career in medicine. Physical medicine and rehabilitation is a specialty focused on the physical conditions as well as restoring function. We treat a whole range of conditions ranging from spine disorders to peripheral joint and nerve conditions. Our treatment toolkits include not only physical therapy and medications, but also mid-invasive injections and procedures guided with ultrasound or x-rays. We treat conditions that affect the bones, ligaments, joints, as well as nerves. Here in the Department of Rehabilitation and Regenerative Medicine, we function as a very multidisciplinary team where we have experts in not only the spine, but also the peripheral joints and musculoskeletal etiologies. Furthermore, my affiliation with OxSpine provides me close contact with neurosurgeons, orthospine, as well as physical therapists to deliver world-class spine care for you and your family. So growing up, I've seen my father treat patients just like how he would treat me and my siblings. They become like family. And so that's the type of care I want to provide for my patients as well. Top quality care that is evidence-based that I would offer all my family members. And also I want to emphasize that every patient is unique. And we want to dive into the details and personalize that care to your needs and your goals. Ultimately, we want to help you do what you love doing again. So in physical medicine and rehab, we don't give up on the patients. We're always constantly trying to find new solutions in order to help you restore your function and help you do what you love doing. And that's truly what drew me to this field. And so if you come to see me, I love to work together with you to solve your most pressing issues and conditions, and we'll work together. Even if a solution doesn't exist right now, we can build it together.